What's up, everybody? Welcome to the Better You Project, optimizing health, hormones, and aesthetics. And today I have a super fun topic with a super fun guest. I've got Krysha Mallari here, who is one of the integrative nurse practitioners coming out of the Philly and Radnor area, working for a aesthetic practice called Body and Beauty Lab. We started working together probably in the middle of last year. It's a very long training process, like most nurse practitioners who train with me know. And so it's been great working with Krysha, developing her integrative medicine skills. And one of the biggest topics that we cover in a lot of what we do is women's health. Specifically, I feel like it's either all the hype about postmenopause, but what is happening in the perimenopause time period. And I almost feel like this is a harder time because hormone fluctuations can happen from day to day. Postmenopausally, there's usually depletion. And so a lot of times the answer is just going to be replacement. But really in the perimenopause, I feel like is where it really needs to be the art of medicine. And that's where I think Krysha's got some great insights, and she's going to share a little bit about her experience. So Krysha, are you ready?
Yes, I'm ready. Thank you for having me here. I'm so
Awesome.
excited. Yeah, thank
Yes.
you.
So
So,
Krysha, talk a little bit about how you got interested in integrative medicine. Let's start there.
right. So most of my healthcare background is actually in conventional medicine. So I worked in like a cardiac setting in the hospital for 10 years. And then I became a nurse practitioner, got my master's degree, and became a primary care provider for 5 years in the geriatric space. So I have a lot of experience, managing complex diseases. But then the pandemic happened. Everyone got burnt out. I felt the same way, dealing with health insurance. And so I decided, hey, my creative side, I can do aesthetics. And then going to aesthetic conventions, I was exposed to functional medicine and integrative health. And I said, wow, this is actually something I feel like I'm very interested in. And that's how I got connected with Lexi. Lexi is actually my mentor. She's been great. She's helped us start our integrative health practice here in Philadelphia at Body and Beauty Lab. And it's been so great ever since. I've helped a lot of women transition in this perimenopause, menopausal stage. So far, so good. Yeah, that's how I
Yes.
got into it.
Awesome. Well, I'm so excited to have you on the topic today because, again, just as we said, you started in aesthetics, and it's awesome because you can marry the two worlds in that you help women feeling beautiful on the outside, whether it's, curing their wrinkles, helping them with skincare, just giving them the confidence. But
Yes.
I'll tell you, as someone who's been doing this a long time, when you get the inside to match the vibe of the outside,
Right.
it's so amazing, and vice versa. So,
Yeah.
so let's jump into kind of some of the topic questions today. So let's talk, if you can define for me, what is perimenopause and how would you describe the transitional phase of what is happening with hormones before menopause?
Right. So as you said, perimenopause is that transitional phase leading up to menopause. So typically it begins about 7 to 10 years before menopause, usually in women's 40s, though it can actually start earlier. And during this time, hormone levels fluctuate so much, particularly estrogen, progesterone, FSH, follicle stimulating hormone, and LH, the luteinizing hormone. So the actual medical definition of menopause is when a female has gone 12 consecutive months without a period. So that signifies the end of the reproductive life of a woman. And that's when the ovaries stop producing hormones, and therefore a woman can no longer get pregnant. But that definition is kind of ambiguous also
Yeah.
because some women, women with IUDs or women who've had a
Right.
hysterectomy and endometrial ablation, they wouldn't have periods for a very long time, but
Yes.
their ovaries are still functioning. So it's kind of not a really good definition. So, and those conditions can also affect the perimenopausal phase as well. They can get into menopause earlier and perimenopause. So it's a fluctuating state. It's very erratic. The hormones shift unpredictably, and it leads to a wide range of symptoms. And to understand perimenopause, we really need to look at what a normal menstrual cycle looks like in the earlier reproductive years of a woman. So usually a menstrual cycle lasts about 20 days, but that can be different in durations for each individual woman. And it's usually a predictable rise and fall of sex hormones. We consider the first day of the day one menstrual cycle of the first day of menses or your period. And during like day 1 to 14, which is the follicular phase, the estrogen rises and follicles develop in the ovaries to stimulate the thickening of the uterine lining. And then around day 14, ovulation happens. A surge in LH or luteinizing hormone triggers the release of an egg, and then estrogen peaks and then declines sharply. The luteal phase, which is day 15 to 28, progesterone then rises to support like a potential pregnancy. And if fertilization occurs, progesterone and estrogen drops, and that triggers menstruation. So in perimenopause, in the later reproductive years of a female, these phases become so erratic and ovulation becomes irregular. It causes unpredictable surges and dips in estrogen and progesterone, and it leads to symptoms such as hot flashes, mood swings, palpitations, irregular periods in terms of duration and frequency. Body composition and fat distribution changes, weight fluctuations happen, and most importantly, mental health changes happen as well. So things like executive functioning, memory, focus, concentration gets affected. It's so unpredictable. And usually I call it like the zone of chaos, but it's usually downward trend until the hormones flatline into menopause. So yep, that's perimenopause. Now in menopause, menopause, that's usually where some stability happens, and women may no longer experience those vasomotor symptoms, but they still struggle with the same issues, such as those mental health changes, low energy, low libido, and more importantly, health risks such as increased risk of osteoporosis, cardiovascular disease, and metabolic compromise.
Yeah, absolutely. No, that was great. Let's talk a little bit about, so one of the things that feeds very well into a lot of what we do is, weight loss management, body composition. We do a lot with peptides, as do you. And so one of the things that I think is very interesting is just as you went over, the rise and fall of hormones and what's happening in the part of the cycle, is that everybody is so different. And one of the things that I see is as women get more perimenopausal and going into menopause, is that the severity of symptoms can be different depending on genetics, lifestyle, environmental factors, phytoestrogens, stress management, gut health, all those things. So let's talk a little bit about genetically. Is there anything that you've seen that would predispose a woman to either having worse perimenopausal symptoms or less perimenopausal symptoms that you know?
Right. So usually, like you said, it's a mix of genetics, lifestyle, overall health. Some women may experience mild symptoms and some may experience more intense vasomotor symptoms. So genetically, African Americans tend to experience perimenopause sooner, I believe about like a year and a half before the other counterparts. Caucasian women are kind of in the middle, and Asians experience it much later. And not really sure exactly why. There needs to be like more research on it. But in terms of genetics, it really plays a huge role. Lifestyle as well. So if someone is a smoker, they tend to go to perimenopause sooner. People who drink alcohol, people who don't get enough sleep, if they have gut health issues, chronic inflammation, IBS, that can also affect the life of their ovaries. So all of those impact how we regulate our hormones. Chronic stress for example, can exacerbate hormone imbalances because it increases cortisol and it interferes with estrogen and progesterone. And nutrient absorption from poor gut health, that also affects hormone metabolism. Especially conditions also such as like PCOS that can affect perimenopause. Women with PCOS often have irregular cycles and prolonged estrogen dominance. And like I mentioned earlier, people who've had a hysterectomy, endometrial ablation. If a woman has had a hysterectomy but kept their ovaries still, that can actually still affect the life of the ovaries. And I've read it affects it by 4 years, kind of decreases the ovarian life. And then if someone had an endometrial ablation, about like a year and a half. So all of those can really impact a woman's experience during that transitional phase.
Yeah, absolutely. So one of the things that we always say in our longevity practice is genetics loads the gun, but lifestyle pulls the trigger.
Right,
and studies actually show that women who tend to, again, have more alcohol because the
Right.
liver is where estrogen is actually secreted, metabolized out. And that if you have a woman who maybe they use wine to wind down every single
Right.
night, their
Yeah.
risk of going through menopause, and not only that, the severity of symptoms is much, much
Right.
greater. The other interesting piece too, just as you mentioned, African Americans tend to have an earlier menopause. Is they actually tend to have more severe symptoms. The other piece of research that I thought was interesting, I was preparing for a menopause talk I was doing on longevity, and what they found is that neurotherapy, while it may not change the number of vasomotor symptoms in patients when provided with like a stellate injection, it actually will improve the severity of it, which I thought was
Oh,
really interesting. As you know, we have a nurse practitioner who is undergoing a
right.
lot of hot flashes, and
Right.
so we're trying to be really consistent with doing neurotherapy, as it's a great non-hormonal option to help
Right.
someone with their vasomotor symptoms. So I always think that's super, super interesting. And just as you mentioned, gut health is absolutely key, which I think sometimes in the roles that we're in, Krisha, is that
Right.
people come in because they were referred by their friend, and they're like, well, I just want to take this pellet, and I want to do this peptide, and I want it to like fix my whole life. And it's like, hold on,
Right.
you're going to have to make sure that we're looking at your nutrition, your sleep, your mindset,
Right.
all these other things. So I think, again, this is where you and I will help differentiate the integrative medicine side from just everybody else who's trying to do this, right?
Right.
Because
I
it
agree.
does matter. It does matter for the success of the patient. Let's
Yes.
talk a little bit about some of the symptoms that we commonly see in perimenopause, because they're literally all over the place. They're
Right.
all over the place. And I tell patients, abnormal is your new normal. So,
Yes.
so let's talk about what are the symptoms that you're typically seeing with your patients.
Okay, so first thing women will usually notice is, irregular periods. So
Hmm.
they're shorter or longer cycles. Bleeding can vary from heavy, light, medium. And then these cycles, in between periods, it could be a regular 28 days, and then they'll go months without a period. So that's usually the first thing. Next thing is the hot flashes, night sweats, and palpitations. And this is due to fluctuating levels of estrogen, and which causes vasomotor instability. That's why they feel the symptoms. Palpitations is a huge thing. Women, it's very uncomfortable, and just feeling the hot flashes during the day. It really impacts women's quality of life, and even affects their performance, work performance, and their day-to-day life. The mental health changes, as I mentioned. So the neurotransmitters in the brain are very sensitive to fluctuations in our sex hormones, not only estrogen, but also progesterone and testosterone as well. So it causes anxiety, depression, irritability, mood swings. Progesterone plays a huge role in sleep and mood regulation. So sleep disturbances can happen. They have a hard time falling asleep, or they keep waking up during the night, which then, sets them up for failure the next day, which, it loses things like motivation, energy levels. They can't quite get to the gym. They can't push themselves to do the things that they want to do during the day. And it leads to, long-lasting impact, and may cause even clinical depression in some women.
Hmm.
Weight gain and metabolic shifts are a huge thing as well, which can cause insulin resistance and cortisol imbalances. So for perimenopausal and menopausal women, a main complaint I hear is that they can't quite get rid of that midsection fat. And I tell them it's because, that estrogen dips down so low. And when the body is depleted of estrogen, your body wants to hold on to that midsection fat, because that's the only source of estrogen that they'll have from there on. And I mentioned earlier, brain fog, memory issues. I hear a lot of women say during this transitional phase, I started having brain fog, like the word escapes me. I can't really think, recall some events or places, people. Yeah, they have a hard time with recall, and it impacts their day-to-day life. And the last thing is definitely changes in libido and vaginal health. Vaginal dryness is a big thing. So for estrogen and even testosterone as well is very important for the vaginal health, and not only the vaginal wall, but also like the urethral wall, the urethral lining. So women will complain of, increased UTI cystitis, some incontinence of the bladder, leaking, stress incontinence. So many things are affected. There's androgenic receptors everywhere in the body, and people just think it's a reproductive, the impact of these hormones, but it's all over. It's in the brain, it's in our vascular system. So it's really important that women are educated about the importance of balancing their hormones, especially during this transition phase into menopause.
Yeah, absolutely. And I think you've touched on all the really common symptoms. Some of the atypical ones that we see is increase in migraines, skin changes, rashes, food intolerances. I actually just got a message from a patient today about her ears being dry and itchy. And that's actually a very, it's atypical, but it's a common of when you're going through menopause. Some other ones are going to be increase in joint pain, more arthralgias in joints, and that, the shift of estrogen, and that it's a lubricating hormone can be the big thing. Another thing that we would see also too on the aesthetic side is they're just losing that volume. So you have estrogen receptors, just as you said, everywhere in your body, your brain, your heart, your bones, your vagina, everywhere.
Right.
It's also in your midface. So you're going to start to see the maxillary fat pads, which is kind of like where your apples of the cheek are. They're starting to shrink and fall, and then they take the whole operation with it. So you're going to see a larger or a heavier nasolabial fold, which then as that travels south, you're going to see more jowling. So on the aesthetic side, estrogen is extremely important.
It is.
For so many reasons. And we have seen some great success utilizing topical estriol in our skincare. Yeah, in our skincare regimen. And actually, we compound it with GHKCU copper, the topical peptide, because that is going to also help from a anti-wrinkling, smoothing out some of that, because it will help block the release of acetylcholine. And then the estriol will help stimulate collagen and elastin. So as I say, it's just like we have skincare for our face. It's great on the vagina, so we have skincare for our vagina, but let's put it also back on our face. So I think all of those things are super, super important, in that you don't have to wait till you're completely done going through menopause. Like, there's so many things that Krysha and I do to help our patients in the perimenopause, because I feel like in perimenopause, it's like you're chasing a moving target, because it's going to be different every day. I think that's great. Let's talk a little bit about, what do you see on the thyroid side of things? I know we're talking about perimenopause, so a lot of times we think sex hormones, but let's talk a little bit about thyroid, because I always say, listen, I want to help you lose weight. The semaglutide is a great option, but if your thyroid is shit, it's like you're running an uphill battle. Like, that's just how it is. So addressing the thyroid, I think, is absolutely huge. Talk a little bit about that, Krysha. Like, why do we look at free T3? Why do we look at free T4? What does that do?
So I educate my patients too. So I do see a trend of the thyroid not being optimized. So we usually look at these reference ranges, and it would be normal when a conventional, physician looks at it and tells them, hey, like, they're within normal range. But in our parameters, it's a bit different, because our goal is optimization. So I tell my patients the thyroid is a very important gland. It's important for metabolism of the body. And if it's not optimized, I don't mean just losing fat. I mean clearing out toxins in your body. I mean clearing out the bad cholesterol in your body. It affects so many functions in the body. The thyroid is a very important organ. So in order to optimize that, we check the levels. We check TSH, free T4, free T3, and also TPO antibodies. I've actually diagnosed several of my patients with Hashimoto's, which is an autoimmune condition where the thyroid kind of destroys itself. And they don't know, because they're asymptomatic, they don't have any symptoms. But then in the long run, if those antibodies, in the long run, it will destroy the thyroid and affect their thyroid function and their metabolism. So usually I see kind of not optimal TSH. So that's when the brain is sending signals to the thyroid saying, hey, you need to work harder. You need to produce these hormones. You're not producing enough. And then not free T3 is the metabolically active hormone that actually goes inside the cells and drives metabolism. A lot of, in conventional medicine, and I know because I was a primary care provider at the time, I thought free T4 was the only thing that I needed to check, not realizing free T3 is the actual, free T4 is the precursor to free T3, and that's the more important active hormone that goes inside our cells. So I also see a lot of not very optimized free T3. Our goal in integrative medicine is between 3 to 4.5, and a lot of the patients I see are below that. So it's not optimized, and no wonder why people are feeling very tired. So what I do to optimize these hormones, I make sure that the basics are met, right? So vitamins and minerals are very essential. So things like selenium, zinc, tyrosine, vitamin A, vitamin D. A lot of people are very low in vitamin D, and they don't realize that's very important for thyroid support. So dietary counseling is a big thing I do to support the thyroid. You're making sure they're eating foods that are rich with these vitamins and minerals. And also we have a supplement that has all this in one capsule that they can take in the morning if someone's, kind of busy and they're like, I just need everything in one pill. And it's very, very helpful. So those are the things I suggest for them to support their thyroid. Yep.
Yeah. No, I think that's great. So, Krysha, I'm just going to go ahead and ask, Krysha, can I just get that on Amazon? Tell me the difference between and I'm saying this because I already know the answer, and that, we have this conversation with patients. And I kind of go back to, you guys are a beautiful aesthetic practice. Just as you get medical grade skincare, medical grade nutraceuticals also matter. What's hard with nutraceuticals is it's not there's not a regulatory body. And so the nutraceuticals that we recommend to our patients are with companies that we have vetted, that we work closely with. If something doesn't go right, I can easily get a hold of that person. If something happens on Amazon, good luck. They'll send you a little gift card back, but you never got things figured out. So, I think, Krysha, can you explain, why you would recommend the difference?
Right. The supplement world is the most unregulated thing. So I tell my patients, hey, I'm giving you, access to this database where you can get third-party tested nutraceuticals, and everything in our inventory are also the same. So they actually have what they claim they have, and it works. Unlike if you just go on Amazon and buy a random nutraceutical, who knows if they actually have the ingredients that they claim they have, and you're just wasting your money that way. So a lot of my patients are very receptive to it. So I'm just glad that, I get to tell them what supplements are would work. So they really, really appreciate it. Yeah.
Good. All right. Well, let's talk about why do you feel like perimenopause often is just kind of swept under the rug or unrecognized, or a lot of times misdiagnosed for just depression or just anxiety or something else?
Right. Okay. I believe it's because of a bunch of things. There's a lot. First of all, I mentioned the wide range of symptoms: mood swings, anxiety, depression, brain fog, joint pain, heart palpitations, and a lot of these symptoms overlap with other conditions such as, thyroid issues, like I mentioned, adrenal dysfunction, and some even clinical, mental health conditions, clinical depression, and generalist anxiety disorder. So it's because there's a wide range of symptoms, it may not be accurately determined in, let's say, a routine PCP visit. Also, just the irregularity of the hormone changes. The hormones are fluctuating so much, it's unpredictable. So these symptoms come and go, and it makes it a little bit harder to pinpoint because they'll feel, bad one day and then next month they're feeling great. So it's really hard to track. Also, just the lack of awareness and education about perimenopause among patients in general, women, and also even healthcare providers. A lot of people are generally not educated about perimenopause. And even I just remember when I went to Nurse Practitioner school, it was maybe just a 5-minute presentation in women's health. So it's there definitely needs to be more focus and attention into educating healthcare providers about perimenopause and menopause.
I had a OBGYN shadow me last week for 2 days on the integrative medicine side. Again, OBGYN has been an OBGYN for 25 years.
Right.
And she said to me, as I'm going through thyroid and all the intricacies of all the hormones and the metabolites is what we were really looking at, is estrone, estradiol, estriol, all those things.
Right.
She said the scary thing is, and she went to a great school, is we didn't learn any of this in school.
Nope.
Like, that's terrifying. You would think like GYNs, like they
Right,
would be the
exactly.
most expert in this hormone metabolite scene. And she's like, I got nothing. I got nothing. So
Right.
it is terrifying. It is
It
absolutely
is.
terrifying. Mm-hmm.
And I hope it changes. I think I actually had I talked to someone who is in GYN rotation,
Mm-hmm.
and I think the landscape is slowly changing. There's more awareness now, and she was telling me that, oh yeah, no, we are pro HRT now. We're
Yeah.
not. We're educating patients that it's important to balance your hormones. So I think something is happening
Good.
for sure.
Good. Oh, that's
Yeah,
great. That's good.
yeah,
So we've talked about symptoms. We talked about why it often gets swept under the
right,
rug. But let's talk about the workup. What blood
right,
work do we consider testing, and what is
right.
it that we're looking for?
Right. So I also want to start with saying like there's no single definitive test for perimenopause because hormone levels fluctuate even daily. So standard lab tests may not accurately reflect what's happening, which is also part of the reason why it's hard to diagnose, right? But we focus a lot on symptoms, but definitely there are comprehensive hormone testing and some lab panels that are very useful that can help us clarify what exactly is happening, right? So I would check a full hormone panel with estrogen, progesterone, FSH, testosterone, and then we even add LH and DHA depending on what their history is. If they have a history of PCOS, I can add those on. We can do, as I said earlier, thyroid panel testing is very important because
Mhm.
thyroid can affect everything in the body, including hormone regulation. So the TSH, free T3, free T4, and even reverse T3. Iron panel to check iron stores, especially considering if women are having very heavy periods, they can lose a lot of that iron and that can affect their energy levels and their ability to make red blood cells. Some metabolic markers such as insulin, glucose, fasting lipids, they affect overall metabolic health, weight management. Also, we may even consider cortisol testing as well because we can try to assess the adrenal function. I actually learned this from you in one of your lectures about cortisol steal, which is like a theory that if someone is highly stressed, that cortisol, those kind of ingredients that make our reproductive hormones such as estrogen, progesterone, testosterone, that can be stolen and be made into cortisol instead, and then thus the other hormones are suffering. And then lastly, we would check the micronutrients like vitamin D, vitamin B12, magnesium, very, very important. They're important for bone health, immune regulation. I like to say B12 is the tech support of the brain and the body. So it helps repair nerves and very important for brain health. Magnesium is important for muscle recovery and sleep and hormone regulation. So all those together would help me determine like the best treatment plan and what to focus on in terms of counseling for my patients. So
Yeah.
those are the
Yeah.
different tests. Mm.
I think sometimes one of the biggest barriers is like I'll have a patient and they're like, I listened to your podcast. I've been following you on
Right,
Instagram. I took these, suggestions to my doctor and they won't check any of my hormones. So now they're seeing us.
right.
And part of it is because
Yes,
I just don't think they know how to interpret it. And what I would
right.
emphasize, to patients is that it's not just labs that tell me and Krysha what the heck is going on with you. It's you. Like, you tell us your symptoms and when they're happening. And we do this really extensive workup that first time we meet. I mean, shit, we're together like an hour and we're getting into detail and all these
Right.
things. So I think part of it is because in traditional medicine, they don't have that time. And so
No,
the nice thing in kind of more of a concierge type setting like what we do is we have that time and we want to get into the details with our patients. So I think that's really,
right.
really important to know. I think the second piece that that I think is oftentimes in the general population is that sounds really expensive, from a blood work perspective.
Right.
But what the great thing about, again, kind of what we do is we've got some great negotiated, discounted, rated labs that we can get a whole panel for really inexpensive. And I can't tell you how many patients where first time I meet them, I go over, and then we've got a self-pay option or you can run through your insurance. I don't know what your insurance is going to cover, but you're more than welcome to check it out. And then they get the lab bill because they opted for the insurance coverage and it would
Right.
have been cheaper just to do our self-pay
Yeah.
discount. So I think if you're a patient and you're interested and you're like, I really want to do this, but I'm worried about the cost. I think honestly, what you will be pleasantly surprised with is number one, it's she's well worth the visit. But two
Definitely.
is that you're actually going to get a way more in-depth panel and probably less cost for what your insurance is going to pay. And I see that a lot too, because so many times nowadays we have patients with high deductible insurances. And then the nice thing is you can use an HSA,
Yeah,
so I think there's a lot of ways to make it very affordable for patients. So you can really, spend your money on your health because you're only going to get one body, right? Um,
exactly.
so I think that's absolutely key. Let's talk a little bit about now, Krisha, is how do we manage some of these perimenopausal symptoms effectively? Where do you start with patients?
Yeah, so a holistic approach really works best when we're, you know, determining a treatment plan for this for our patients. So usually I always emphasize lifestyle. So things like their diet, focusing on whole foods, and anti-inflammatory diet or Mediterranean diet is probably the best for them. Definitely emphasizing strength training, improving the muscle mass. A lot of my perimenopausal patients, we have a machine called InBody, and that can measure muscle mass. And a lot of them are below average, and it's because, their hormones are fluctuating, especially testosterone is decreasing since in our 20s. After our 20s, we lose about 1 to 3% of testosterone every year. So then that kind of puts us at a difficult spot in terms of increasing our muscle mass. So strength training is definitely important. I counsel them heavily on making sure they meet their daily protein goal. So because that will help them build muscle mass. Stress management, like I said earlier about the cortisol, so breath work, mindfulness, making sure they have a good sleep hygiene. They're very crucial. And the biggest thing is really hormone replacement therapy as well. It's a very great treatment. So, but HRT or hormone replacement should really be personalized based on, people's individual risk and needs. So in terms of hormone replacement, there are a few options, which I always discuss the FDA and non-FDA approved options. There's also synthetic versus bioidentical hormones. And that's probably like the biggest debate when it comes to the HRT world, right? So synthetic hormones, they're made from animal or chemical sources, and they may not be an exact match to human hormones. So common examples are like conjugated equine estrogens, ethinyl estradiol, synthetic progestin, such as medroxyprogesterone acetate. And then there's bioidentical hormones, which is usually what I go for. These are derived for plant sources such as soy and yams, and they're chemically identical to the hormones that our bodies naturally produce. So when I check those blood work, like after I put them in bioidentical HRT, when I get a repeat lab panel, it actually shows up because our body recognizes it as our own. So the main argument in favor of bioidentical hormones is that they mimic the body's natural hormone function more closely, and it can potentially lead to fewer side effects and a better absorption. But not all of bioidentical hormones are FDA approved, and some compounded version it may vary in quality and consistency as well. Yeah.
Yeah. So I think you've touched on so many great things,
Right.
is that there's more than one way to help our patients. And what's
Right.
great is we customize it to what the patient's preferences are and what they're comfortable with. And I think when any person is seeking a hormone treatment, I think getting all the options and not just one option, I think is absolutely key in this kind of arena.
Right.
I would say, any other, closing thoughts, any other things that you feel like maybe we didn't touch on the perimenopause space? I feel like it was a great overview. Anything in particular, Krisha, that you've seen or that you feel like is not, shared a lot?
Yeah. So I just want to say the perimenopausal, menopausal women I see, when I optimize them on their hormones, when I put them on the important nutraceuticals that they need to get, that lifestyle counseling with the diet and strength training, protein intake, all that, when they come back to see me, it's like they're a whole different person. Much happier. They say they don't have memory, brain fog issues anymore. They enjoy life. I think someone has told me before, the world seems like black and white, and then now it's full of color. So it just warms my heart seeing these women thrive, especially during this phase, because usually, 50s, 40s, 50s, that's when women are in the height of their careers, so it's just a shame sometimes that some women are not educated on ways to optimize their hormones this way. And I'm just very happy that Lexi was there to help me, understand all this and teach me all the ways into building this integrative health practice. So I'm able to help all these women during that transition phase, especially to menopause. Yep.
Yeah. Yeah. No, it's been great watching you grow, helping you see through kind of the initial phases and like, okay, they've been optimized. Like, where do we go next? Right. So I will tell you that's one thing that Krysha will continue to do. She's always going to be learning and adding some new services and good stuff to the BBL service line. So Krysha, is there a promo that people can maybe use to get in to see you? Let's talk about that.
Yeah, so if you are in the greater Philadelphia area or mainline Philadelphia area, we have 2 locations in Philadelphia. It's Body and Beauty Lab, Philadelphia, and also Radnor, PA. So if you are coming in for a consultation, just mention the Better You Project podcast. And if you listen to this, we are doing a free complimentary lab panel. So we were talking about the cost earlier, right? So that's going to be complimentary for you, just coming for a consultation. And this is just a way, for us to thank you for listening to this podcast. And hopefully you learned a lot. And I hope to see you at our practice soon.
Yeah. Share it with your friends. Okay. So where can people find BBL online? Website?
It would be, I believe, bodyandbeautylab.com. Yes, okay. bodyandbeautylab.com.
And then
we're also on Instagram, Body and Beauty Lab on Instagram as well. Yeah.
Yep. And then if people want to follow you on Instagram, Krysha, what's your handle?
Yes, my handle on Instagram is Krysha.np, so KRYSHA.NP as in Nurse Practitioner. Perfect. And I post some videos. I'm trying to be like Lexi and posting more educational videos there. So
it's a slippery slope. It's a slippery slope. All right. Well, this has been awesome, Krysha. I hope that for all the listeners that are listening, you took some great information away. Again, if you're in the Philly area, mention the Better You Project, and you will get a complimentary lab panel with Krysha. And yeah. Cool. Thank you, Krysha.
All right. You're welcome. Thank you, Lexi.